but you should never stop teaching for the sake of testing unless you really have something on your mind. So what is the question that you're trying to answer? What is it that you don't yet understand about a student, about a classroom, about a grade, about a district, that you really need data and information in order to help you answer that question? So thinking about assessments in the context of what is my question, and then what is the assessment or data that I need that is most efficient for me to answer that question. So when we think about, there is so much power in being able to ask the right question. So when we are able to ask the right question, we know that we can reserve the majority of our time for teaching and really be very smart on the test and assessments that we choose to use. And that's really, really important. I always say to people, if they don't know what the question is, then don't test the kid, just teach more. Just teach more, because we know that good instruction is what actually moves the needles for kids and is most beneficial. Not more testing, but testing for the right questions and in the right circumstance. So when we are thinking about those questions, we know that we want to gather information that will really help us make better decisions. And these decisions occur at all different levels, right? Sometimes we have decisions that affect a district, or maybe it's a decision that we are really pondering that is school-based, or maybe it's about a particular grade. It could be about a classroom. It could also be about an individual student. So there's many different layers to this. So let's talk about the different assessments for different purposes. And there's typically 4 different types of assessments that people often share and talk about broadly. The first one is outcome assessments. These are administered to all students that help answer the question, are students proficient on grade level content? So you can think about these as a lot of the requirements for state level testing that we often give to all of our students, because we want to know, given the content and the standards that all 3rd graders are supposed to learn, is there a way to measure that to determine whether or not the students are meeting those levels of proficiency? So we consider that an outcome. But what's important is that it's given to all students. Then we have universal screening, and universal screening is really, really, really important, particularly when we talk about students who are struggling in reading, and particularly students with dyslexia. When I refer to universal screening, we really think about it as, again, administering an assessment to all students, because we want to identify who is at risk for not being proficient in the future. So it is a predictive type of view that we're taking when we screen students. So when we think about screening all students for reading difficulties, we are also, because it is done with all students, the net is very wide. And when we have good universal screening in place, we also get those students who may eventually be determined to be dyslexic. So because what we want to do is we want to identify all students who are struggling. And then once we start intervening with them, we can monitor their progress. And that ends up being the 3rd level of assessments for different purposes. So when we talk about monitoring students' progress, that's not something we need to do with every student, because not every student is at risk and not every student needs differentiated instruction. But for those students who our universal screener has identified we need to do something different with, then when we provide them with good, targeted, differentiated instruction or interventions, the question we have is it making a difference? Are they getting better? So we want to monitor their progress so that we can answer that question. If we're going to give them more of something or teach them in a different way, we have to be able to answer the question, is it helping them? So it's typically only done with a few students, not all students, but it's very, 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 very important. And if we think back to the one slide about when we think about students with dyslexia, they tend to not get, not improve similarly to other students, even with the same good instruction. So that's where we can start pulling apart students that just have other types of reading issues where good targeted instruction might be able to catch them up quickly, but we have these few students who are going to persistently not make the progress that we would expect given that they're getting good instruction. And that's when we start suspecting there's something else going on with them. We need to look at these students more in depth, and we need to try to figure out how can we really narrow in on where their issues are so that we can really help them. One of the ways to do that is to diagnose, to give them a very specific assessment that will allow us to pinpoint. So you have to think about it more as surgery, right? When you go in and a surgeon needs to make an incision, and if you have melanoma and they need to remove a mole because it's suspicious, they don't want to take off more than is necessary. So when we think about diagnostic assessments, we want to make sure that we are identifying the specific area that the student is struggling with, but we want to be able to link our instruction so that we are more precise on what the student needs so they can increase their reading skills and perform better. So diagnostic assessments is not something you want to give to every student. It's really those students who, given good instruction and good interventions, when we monitor their progress, that they still, for some reason, are not making the gains, are not improving at rates that we would, that we know other students are improving at. So we need to dig a little deeper, and we need to get more specific on what their needs are so that we can address those.